Hi, and welcome to this installment of Frank and Mary here in Hudson. If you haven't watched this show before, my name is Art Bergeron. I'm an elder law attorney. My day job is doing elder law at Myrick O'Connell. With our offices are in Westboro and Worcester and Boston, and we're a big firm. But this is not about my day job. It's really about Frank and Mary. If you've been to one of my many presentations at the senior center, you know that Frank and Mary's goal in life is to live in their house until they die and be buried in the backyard. And if that's Hudson, that means you want to stay right here. You don't want to go far away. And so the point of this show is to let you know the people that you need to know and the programs that you need to know about in order to stay right here in Hudson for the rest of your life. So Janice Long has often helped me on these shows by recommending wonderful guests. And today she recommended Alex O'Hare, who is here with us. And thank you very much, Alex, for being willing to come on the show. I really appreciate it.
Yeah, thank you for having me.
And Alex's official name is as the town social, basically the town social worker, although she works out of the Board of Health and just provides a variety of services. And Alex is here to talk about those. She provides them in a lot of different contexts, but specifically spends quite a bit of time, she was telling me, at the senior center. So Alex, can you start off by just telling us kind of like, who are you? Are you from Hudson? Are you from not from Hudson? How long have you been doing this? Kind of what's your background? And
Yeah,
how long have you been doing this now?
yeah. So I was raised in Hudson, so I grew up in Hudson. So I'm very familiar with the town. That's why when this position came up, I was very passionate about coming back to Hudson. But right now, I live in Lancaster. I would
Mhm.
love to live in Hudson if I could afford it.
Well,
Um,
Hudson's just getting to be such a hot town,
it
It's
is. It is.
everybody's getting priced out of, who would have thunk it? Everybody's getting priced out of Hudson, right?
Yeah, even Main Street, they beat out Vegas Main Street, so it's
Yeah.
definitely a booming town, and I would love to come back and live here, but can't afford it. But my background, so I went to undergrad. I got my BSW, my Bachelor in Social Work, at Regis College, and then I went on to graduate school in Boston to Wheelock College. And actually, during my undergrad, I was actually the senior center intern when I was going through
Oh,
my college. So that's where I originally met Janice, and we ran this friendly chat program that was really great for homebound seniors that really didn't want people in their homes. So working with Holly and Anna over there and Janice of the people that would, and that was back like 5 years ago when I was going through my undergrad.
yeah.
So I graduated from my graduate program, and I worked at a nursing home for some time. I worked for Advocate, which is a nonprofit organization for mental health. And then I found that the position came up for a town. Janice told me about it, and I'm very passionate. Everyone's so friendly here at the town of Hudson. I grew up here, so it still will always be a part of me. And so I took the opportunity, and so I've been here since September, and I love it so far.
That's great. That's great. Tell us about kind of what you do and kind of if you could start off with kind of what you do in general and then talk a little bit about what you do specifically as it would relate to Frank and Mary or to Frank and Mary and their kids and Frank and Mary and all the different situations that they may be finding themselves in, especially given you've been here for an amazing time during this kind of extremely high stress COVID time, and that stress seems to be dissipating finally, but we'll see.
Yeah,
Talk-
hopefully.
Yeah, hopefully.
But yeah, so overall, I really help people get connected to resources, and I help with like the referral process as well. So that can stem from housing applications, mental health referrals, even assistance with like mass health application, navigating the health connector, making sure that people can be set up with doctors, financial assistance as well if people are more food insecure, resources for like the food pantry. I'm also the leader for now. I took over for Callie. She was the one that was running it through the Hudson Health Department, but I took over. We run a Hudson mobile food pantry
Yeah.
twice a month too for people that are in need of more food, which I have found has been a major barrier. And me and Janice, we have also been working on running some groups over at the senior center as well. So we ran a couple groups. It was a holiday blues group, and we're going to be running a winter's blues group actually this following Thursday. So for people that do have a seasonal like affective disorder that suffers from depression, anxiety, more around the holidays when we're not getting enough sun, the people are able to come to the senior center, sign up, and I would be able to give them clinical consultation as well. People are able to make one-on-one appointments with me until they are set up with a therapist, because we are in a mental health crisis right now, and the wait time can be up to 12 weeks, unfortunately. So I hold a license. I'm a licensed clinical social worker, so I'm able to provide that clinical consultation to our residents as well.
That's a tremendous variety of services. Can you talk about, from your perspective, because you've really been on the ground, what has happened in terms of this, just not being able to find mental health professionals?
So I part of it is because of, I believe, the pandemic. Most people, when the pandemic started, are more isolated. They're not seeing their family as often. So definitely an increase of depression. We tend, when we do isolate in our homes, the increase of depression, anxiety increases. That's a big part of it. So a lot of people are needing therapy now. Another part of it is there's just a lot of turnover in the mental health field as well. So some therapists are leaving, new therapists are coming in. And another part of it too is like someone could be looking for a specific therapist. They want a therapist that are older than 45, that are like, we have a large Portuguese speaking population in Hudson too. So in need of a Portuguese speaking therapist. So there's a lot of factors why we are in that mental health crisis, but I think that there's just such a high need of therapy right now, just due to the pandemic and how it's affected our population's mental health overall.
So when is it part of your role to actually help people kind of find who would be an appropriate counseling person for them to be talking to?
Yeah, so I work with the family. Any resident through Hudson, I help. So parents, kids, older adults. So I work with the families and see what they're looking for. And it's like an intake process with me. I see what they want, what they're looking for. And then when I put that referral in for advocates or other local agencies, I can put that information in so they are linked to the right therapist, because a therapist is just like a relationship. You have to have a connection with that therapist. So you want to have a good fit.
And that must be a real challenge, just trying to pair folks up. Like as you had mentioned, the notion of my, feeling really stressed out or anxious or whatever as a result of the pandemic or whatever I'm going through. And I may not really relate to a person who's like 40 years old,
Right. Exactly. So that's like part of it. Like if people there's some people that come to me and they say, oh, doesn't really matter to me. But someone's can come to me, hey, I want someone that's female, over 50 years old, that's Portuguese speaking. So it's hard when it comes to those specifics.
Yeah, that's got to be a challenge. And are a lot. So when you're doing that kind of intake and then connecting people, are most of the counseling sessions now, or the therapy sessions done by Zoom, or is any of this happening in clinicians' offices or happening at people's homes? How does all of that work?
So they are doing in person now. In the beginning of the pandemic, when everything was shut down, they were only doing Zoom. But now they're leaving the choice up to the client whether they want inpatient or over Zoom. They depending on the agency, most agencies aren't doing like in home therapy just due to COVID and the pandemic
Mhm.
still. But most people do benefit more from the in-person visits because it's just more beneficial face-to-face having that therapeutic session. So most people offer the in-person, which most agencies are continuing to doing right now.
I see. And you said that in addition to trying to connect people with those kinds of sessions, you were actually doing some actual things right at the senior center? What can you describe that again?
Yeah, so we're running a couple groups. We're actually trying to get a caregiving group together too. So originally we did a holidays blues group, so that was around like the Christmas time and like New Year's for people that have like lost loved ones, and the
Hmm.
holidays are especially difficult at time. So getting a group together for people to like understand that you might not have the same experience but similar experiences, being able to have that group together in that space. And then we're running a winters blues group next Thursday, and it's kind of along the same line. It's a seasonal affective disorder that comes into play around the winter seasons because we're not getting as much sunlight. And
Right.
then the caregivers group are for caregivers that have like loved one that they're taking care of, like that carry a diagnosis of Alzheimer's or dementia, or just older hospice care, that do need like a break, or they're feeling frustrated, and it's a place where they can express how being a caregiver, how that affects their mental health and onwards.
And I suppose for those kinds of programs, for things like folks who are going, who have a loved one who are in the last year of their life and they're trying to deal with that, or for people who have a loved one who has memory problems, the groups must also just be a wonderful. They're just kind of a way to share kind of how to deal with particular issues, because as I think someone had told me, it isn't like this is rocket science. People have been frail and in the last year of their lives since there have been people, and there are a lot of people who have gone through working with folks with memory problems. But a lot of times it's like, unless you've done it, it's hard to understand it, right? First
Right.
of all, unless you've done it, you're in the middle of it and you think, oh my God, I'm all alone here. And, is it just me? That I just
Mhm.
can't handle this? But once you're in a group and you realize other people have gone through it, it just makes it a lot easier to deal with.
Yeah, exactly. They feel validated and they have someone that they can talk to that really understands fully, which is like what we're trying to do, is to have that kind of support group for those caregivers. So me and Janice are working on that, and hopefully we can get that up and running in the next couple of months as well. And it would be a monthly thing for residents to come into the senior center, and I will be facilitating it.
And I guess that leads to kind of a broader question. So you're dealing with a whole variety of issues and dealing with a whole variety of needs. Do you have a particular sense of kind of like what is missing? Like, if you had the resources, what else would you be doing? Because you're obviously, are you kind of a one woman show there in the.
Great. Yeah, well, I have a good team. Like I work with Janice and Holly and Anna, and I get referrals from them. And I'm the only licensed social worker for the town.
Mhm.
So I would be able to provide like that clinical expertise. So another program that when you talk about what like kind of like the barriers of the resources, I feel like one of the things that have come up when I'm talking to Janice and talking to the residents is that there's definitely a barrier in like transportation. because we do have the senior bus that goes to Hudson and Marlboro for medical appointments. But if, like, let's say a senior has a appointment, like a specialist in like at Emerson Hospital or Boston, they don't really have that means for transportation. We have like Ubers and Tommy's taxis, but that can be expensive.
Right.
So me and Janice, and working with other towns of people that have like done these programs before, like a patient navigator program, being able to have volunteers, being able to bring them to these specific appointments, and having an advocate there too. So if they forget questions, or if they have more anxiety seeing the doctor, they would have an advocate with them as well. So that's another program that hopefully we get up and running as we get volunteers.
Geez, I would think that would be a great idea, because I think that's one of the most stressful things for anybody, but for a senior certainly, to be going to a doctor's appointment and then to kind of be there, if you're there all alone, right?
Exactly.
And then you leave the office and like, what did he say again? Or what did she say again? Because especially if you're talking about real problems that you're experiencing, you're stressed out about that. And so you're not kind of really trying to focus on the conversation. So that'd be a really interesting program.
Yeah, it's definitely like that's what we found as a barrier for the town. And they would, like, this volunteer would like call them a couple of days before, how are you feeling about the appointment? Let's go over questions that we can write down beforehand. So meet like before, during the appointment, and after, how do you think it went? And also having that transportation available to the resident, which would be fantastic if we'll be able to do that.
That's a great idea. And did you say that you know of other communities in which that kind of service has been developed?
Yeah, so we're working with, we found out about other programs from a resident in town, and Concord Senior Center has a program similar to this. So going through like the training and being able to recruit volunteers, that's the next step for us.
I get it. So I guess I would just say stay tuned. I would assume that there'll be
Yes.
information in the senior center, in the newsletter and stuff, kind of regarding that. So I didn't realize that. Are you the person that is kind of the intake person regarding things like the fuel assistance program and other things?
So Anna and Holly, they usually do for seniors. So for people that are 55 and older, since I'm the community social worker for the town, they're still like the social services advocate. So they do most of the fuel assistance. But if someone comes to me needing fuel assistance that are under 55 and older, I usually assist with that, since like I'm the social worker in town. So people that are younger can come to me.
I see. So that makes a lot of sense, because in the case of seniors, there's really kind of this kind of designated group of folks, right? That are kind of dealing with this. So how long have you been doing this again in Hudson?
So this position I started back in September. So just a few months now.
Yeah, so you've obviously learned a lot in a few months, right?
Yes.
And can you and in addition to going to the senior center, do you go to people's homes, or do they need to go to you? And which leads to the next question, kind of where are you, and kind of what is. And by the way, we'll ask the wonderful folks at Hudson Cable to do a banner that has your contact information, that has your phone number and stuff, and your email address.
Great. Yeah.
But how would people go about finding you?
So I'm usually at town hall on Mondays and Tuesdays. Those are the folks that are under 55 and older that want to make one-on-one appointments, whether fill out applications or just need that clinical consultation. So people can come see me face to face. If they feel more comfortable on Zoom, we can do that. I've also met people in the home, like for home visits, because I do that if a concerning issue comes up with like housing or safety. I do that as well. So they can either find me here Mondays and Tuesdays, or at the senior center on Thursdays. And then they can reach out to me via I have a mobile phone, and I also have an office phone number too, and my email address that they can reach me as well.
and so now once again, you've been here kind of at the what we hope is kind of the tail end of this whole pandemic experience, right?
Mhm.
And so can you just kind of talk about your sense of how people have been feeling during the time that you're here, and how, how things are changing, and what you anticipate for changes coming up?
Yeah, I feel like when because the word is like getting out there, I'm getting more busier now that people know I'm here. So people have expressed their gratitude and appreciation. They've been wanting a social worker for the town. We've never had a town social worker for the town since I don't think we've ever had one before. So
Wow.
there's, yeah, so they're definitely like the residents, people under the Hudson Health Department or the senior center, like it's definitely in need. And I feel like the main thing the majority that takes up most of my time is the mental health referrals, because people are really in need. And that's what they did, like don't know where to start, what therapist should I go to, I have this insurance. So it's definitely it's very helpful me being here,
Yeah.
helping them navigate that. So that I would feel that is like the major need. So I feel like me continuing to do that for referrals, setting people up with therapists, helping up with even just like the insurance piece. Like people don't really know how to start with that either. That I feel like more people will be having providers, and I feel like the overall mental health will make a difference. Me being here, helping them being set up with these counselors or psychiatrists.
And can you just speak for a second to the issue of the insurance? Like, does Medicare cover any of this? If is
Yes.
suppose, because I didn't know that. I
Hmm.
didn't know that. Can you
Yeah.
just talk about that a little bit? Because
Yeah. So
obviously that's Frank and Mary. One of the Frank and Mary's biggest concerns is they don't want to run out of money before they die.
right.
So they're I mean, they don't want to get just so depressed about paying for the service that they
Hmm.
that ends up making them sick. So
Yeah.
talk about that a little bit.
Yeah, and that's why like it's good that I'm here being able to assist with that. And like the senior center also helps with the insurance piece too. And once they are set up with like the insurance that is well suited for their finances, whether it's Mass Health, Medicare,
Yeah.
I go and I do my part, and I find the agency or the therapist that will take that insurance so they don't have to pay out of pocket, because that's not what I don't want to set them up with like a private like agency therapist where have like a large copay. I want them to be able to find a therapist. And Advocates is a great organization that takes most insurances. So that's usually my referral process is I refer out to Advocates and I do that intake process with them.
I get it. I get it. And you refer to advocates regarding both seniors and folks who are
Yep.
younger.
Yep. So they have therapy, like psychiatry too. So whatever they're looking for, if they need med assistance as well, Advocates will
Right.
be able to help with that.
Right. Right. So, but that makes me think it may be interesting to have a follow-up show to maybe bring some folks in from advocates or from one of these places, just to kind of talk through those kinds of services that they provide. Because I think that a lot of people simply aren't going to be as aware of all of that. Right.
Yes. Advocates is a great organization. They have a couple clinics. Their main office is in Framingham, but they have a clinic in Marlborough, Harvard. So depending because I'm dealing with residents that are from Hudson, I usually refer them to the Marlborough clinic, which is right on Maple Street, and it's very convenient. And I've had great experience with Advocates.
I get it. So I guess, folks, for the folks who are watching, so if you've survived, and you survived the pandemic and you're still standing, and that's great, but you're just feeling like, boy, that was just a terrible couple of years. And if you're feeling, especially if you're feeling like that it's really taken a toll on you, if you're feeling, as are a lot of folks, like a lot more anxious or just a lot more depressed, I think you may want to consider talking to Alex and see if through Alex, you can perhaps get somebody to talk to. Ideally, not a family member, because they're probably the people you've been fighting about or over the last few years because you were feeling so crummy. Some other person who can, among other things, just tell you that you're not crazy, and tell you that a lot of people have gone through this and stuff, and then help you look for somebody, a professional, people someone like Alex, who has really spent time and educational time trying to help understand how they can help you, and because I think that's the whole point. Now you have the benefit of living in Hudson. You have your own social worker. How good is that? It's like it goes with the rail trail. Hudson's getting better and better. So Alex, I really, really appreciate your taking the time to do this. I know that it is clear from what you've described that you have a busy day. And so thanks for taking some time out of this busy day. And folks, so now you know who Alex is. So this isn't like a nameless bureaucratic face that you're calling, right? So, if you think that Alex can be of help, she is there to help you. These are your tax dollars at work. So think about whether she can be of assistance. So Alex, thanks a million.
Yes, thank you. And I wanted to remind everyone, Winter Blues next Thursday. If anyone wants to sign up, just call the Senior Center.
And so that's Thursday, the 16th, 17th, like the 24th?
It is the 24th, and it's from 10 a.m. to 11 a.m. at the Senior Center. So just call the Senior Center to sign up.
That's great. Thanks again, Alex. Thanks to the folks at Hudson Cable for doing this. And we'll see you on the next installment of Frank and Mary here in Hudson. Thank you.